This presentation will cover a little bit about surgery in lab animal facilities. So as far as training goes, there are certain areas of surgery that we have to have our personnel trained in. The first is asepsis, and they also have to be able to handle tissues gently and minimally dissect them and appropriately use the surgical instruments to do this. And they also need to achieve effective hemostasis, so stopping blood flow, and then correct use of suture materials and patterns to close up their patients. And then knowing the species differences is one of the other things that these surgeons should know when they are performing surgery on various lab animal species. So pre-surgical planning is a really big part of lab animal management in regards to surgery. We have to identify the personnel and their roles and what their training needs are prior to surgery. We also have to make sure we have the procedure facilities in order to have surgery for the lab animals and have all the equipment that we need. And then the perioperative animal health assessment and care is a really big part of what happens with our animals. So perioperative care includes both preoperative, intraoperative, and postoperative phases of surgery. So do we have employees or personnel that are available to help with the preoperative needs, so inducing anesthesia, preparing the animals for surgery. Then also do we have intraoperative personnel who are dealing with what's going on during surgery, levels of anesthetics, whether the patients are under anesthesia well or waking up, and then postoperatively for pain control and recovery. And then we also have to have record keeping that goes along with all of our surgeries. As far as the surgical facilities go, they should really be dedicated facilities or spaces for surgery, and we should have them in positive pressurized ventilation when it's available. That's again going to keep your any contaminants out of your surgery room so that it is cleaner within the surgery procedure room. Surgical procedures are broken down into a couple different types. So we have major versus minor. A major procedure opens a body cavity like the chest or the abdomen. A minor procedure doesn't expose a body cavity, so that might be wound suturing, putting a catheter into a peripheral blood vessel, a biopsy that's percutaneous, so near the skin. Routine agricultural animal procedures like large animal castrations fall under minor procedures as well, and any outpatient procedure that could be done in a clinical veterinary practice would be considered minor as well. Sometimes laparoscopic procedures are considered minor, some are considered major, really depending on what's happening within that surgical procedure. And then procedures are also broken down into survival versus non-survival. Non-survival procedures mean that animal is euthanized before they recover from anesthesia. So it may not be necessary to follow all of the techniques for asepsis, but at a minimum we still clip the surgical site, wear gloves, and use clean instruments in a clean area. So it may not be as particular for asepsis as survival, but we still try to be as clean as possible in non-survival procedures. So aseptic technique really requires the input and cooperation of everyone who enters the surgery area. This includes the prep of the patient, the prep of the surgeon, the sterilization of any instruments, supplies, or implants, and then the use of operative techniques to reduce the likelihood of infection. So we maintain our sterile field by doing several important things. Making sure we are appropriately dressed, so no street clothes in the surgery or procedure room, that we're always facing the sterile surface, and when we're sterile, we don't lean over or touch a non-sterile area. We also attempt to keep our hands and arms above the waist and below the shoulder and keep those sterile surfaces dry. We avoid excessive movement or non-essential traffic in the operating room and avoid shaking items that will stir the air current and increase the possibility of contamination. One thing that maybe not everybody thinks about is also keeping the conversation to a minimum in the operating room, and that will help reduce the contamination of the atmosphere because you're not having that conversation. So studies have been done that show that the contamination of the operating room atmosphere increases proportionally with the amount of conversation. As far as pre-surgical care of the animals, for most of our species we are fasting them to decrease the chance of aspiration pneumonia, which is the inhalation of vomited material into the lungs. However, we don't do this with rodents or rabbits because they're unable to vomit, and then that shortened, they're unable to vomit, and also their blood glucose could decrease very rapidly, and that's something that we want to be paying attention to. We may give them a shortened period of fasting when we're doing gastrointestinal surgery. If we're looking at guinea pigs, we tend to fast them overnight if the procedure includes endotracheal intubation, so that way there's no food in the folds of their pharynx to get in the way of the tube. And then we also, when we're preparing our patients, want to avoid wetting the animal beyond the incisional area, because that causes concern for hypothermia in our small patients. So when we're applying the antiseptics, we're using concentric circles, and then we're applying either alcohol or some other antiseptic to remove the detergent and extend disinfection. And again, we want to make sure that we're within the incisional area only for these animals so that they stay warmer in general. There's a good list in the Lab Animal Technician book, chapter 12, of the types of instruments and their uses. So you'd want to be familiar with those. And then cleaning of instruments. So what we do with cleaning of these instruments is we immediately after use wash or rinse them to remove any blood, debris, or microorganisms. And that prevents them from drying or adhering to the instruments. And then we're also checking the instrument function at the same time. Do the scissors cut well? Do all of the clamps shut properly? And then we'll sterilize the instruments or materials after they're already clean. And various methods are used for that. Autoclaves, ethylene oxide gas chambers, hydrogen peroxide plasma, dry heat, or even liquid sterilants can help with sterilization of instruments and materials. Post-surgical care begins when the surgery is completed and ends when the animal is fully awake and resuming normal species-specific activities. So some things that we do during post-surgical care, we might turn the animal to avoid blood pooling and also allow their lungs to expand on each side. We want to keep them warm and quiet and assess their vital signs frequently. One of the important things is protecting these animals from self-injury during recovery. They tend to go through a period of dysphoria where they don't really know what's going on, and that could cause trauma if we're not making sure they're safe. We also want to remove any food or water from the cage to prevent choking or drowning at the very early stages of being awake. And then watch for complications, which we'll address immediately with veterinary care staff. And then lastly, we'll assess pain and distress. And this is something that happens again from right when the surgery is completed all the way until they're resuming their normal activity. So some of the signs of pain and distress that you may see in laboratory animals are a little bit different than you might see in other species. The reason for that is many of our laboratory animals are prey species. So it is their job to not show the predators that they are experiencing pain and distress. So some of these signs are very subtle. So guarding is when an animal protects a painful area by moving away or hunching their posture. Vocalization, we're talking about atypical vocalization. Anytime the area is moved or palpated or sometimes not moved or absence of manipulation could cause this atypical vocalization. Facial expressions may be altered in some of these animals if they're experiencing pain or distress. And then in species like horses, sheep, rabbits, chinchillas, you might hear tooth grinding. There may be an altered respiratory rate and character. That can show thoracic or abdominal discomfort, and it doesn't allow adequate ventilation of the lungs. Restlessness, pacing, weight shifting, repeatedly standing up, lying down, that's a sign of pain and distress in our species. Recumbency, where they're lying down for long periods of time and failing to rise when you stimulate them. And then we have difficulty ambulating, so limping, not weight bearing, not extending a limb would fall into that category. Abnormal postures for our species include head pressing, tucking the abdomen, hanging down their head, a head tilt, or a stiff gait, as some examples. Self-mutilation, specifically in our non-human primates, but also in our other species, includes licking, biting, kicking, pressing, shaking, or scratching the painful area. Anytime you see abnormal temperament, possible aggression towards the handlers, that can be a sign of pain and distress. Reduced self-grooming, ruffled or soiled hair coat can indicate pain or distress. In some of our rodent species, you'll also see porphyrin staining because of that reduced self-grooming. And then changes in eating or drinking, reduced consumption of food or water, that may indicate pain and distress. And then abnormal eliminations, so altered amount, altered appearance, change in frequency, that could indicate something going on as well. So these are all some important things to remember with your laboratory animal species, that they may hide their pain and distress more than other predatory species. So there's, again, this chain from pre-surgical care to intra-surgical care to post-surgical care that's really important in terms of managing surgery within the animal facility.